Die meisten Patienten.
In most patients, the condition is not diagnosed at first because this clinical picture is extremely rare. In Germany, 1 person in 50,000 develops this condition, and it's often mistaken for an allergy because the symptoms are similar to those of an allergy. That is, there are swellings in various parts of the body, and this disorder is also accompanied by swellings, particularly of the skin and the mucous membranes. And we actually have patients who come to our practice, to the medical center, for the first time after 20 to 30 years of going from one doctor to the next, and none of them had diagnosed the condition. Some patients even ended up receiving psychiatric care because they were suspected of feigning illness.
Unterstellt hat, dass sie Krankheiten simulieren. Das hauptklinische Bild ist,
the main clinical picture is swelling of the skin, of the mucous membranes, everywhere where there's mucous membrane in the body.
Überall, wo Schleimhaut
That is, in the intestine, in the stomach and in the larynx. That's where it's most dangerous, because if swelling occurs there, the patients may die of asphyxiation.
die Patienten ersticken können.
We know that in most cases, 1 or 2 patients in the family choked to death because the clinical picture could not be identified.
Weil man das Krankheitsbild nicht kannte. Da es an der Haut Schwellungen gibt.
Since there's swelling of the skin everywhere in the body, that is, in the face, the arms, the legs, the back, the chest, and the genitals, in other words, since swelling can occur everywhere, most people suspect an allergy in the first instance. And doctors also suspect an allergy at first, simply because that's the most common cause of swelling.
Und jetzt kann es sein,
you may have abdominal pain. Then, of course, you might say, perhaps a particular food or alcohol or spices don't agree with me. Then the allergologist must determine whether the patient still has the complaint when they stop eating that food. If the patient does still have the complaint, then it's due to something else, of course. Then hereditary angioedema must be considered, if the swellings don't respond to cortisone or antihistamines, for example. That is, to the medications that usually help in the case of allergies. Then a specialist should be consulted immediately.
Einen Spezialisten aufzusuchen. Ja, es ist eine Störung im Komplementsystem des Menschen.
It's an imbalance in the human complement system. That is, an inhibitor of complement is missing. As already mentioned, this leads to severe swelling of the skin and mucous membranes. It's a genetic defect. The disease is inherited. Chromosome 11 is damaged, and when someone has this disorder, that one of the chromosomes is affected, then the protein is either missing, meaning that it's completely absent, or it doesn't function correctly, and that leads to these swellings.
Das führt dann eben zu diesen Schwellungen. Man kann,
if the protein is missing, it can be replaced. This is also found, for example, in hemophilia, the bleeder disorder. These patients are missing the blood coagulation factor 8 or 9. When it's replaced, the patients don't bleed anymore. Otherwise, they'd bleed all the time. It's similar with this disorder. The patients are missing the C1 inactivator protein, and then they develop swellings.
Und dann bekommen sie Schwellungen. Sie ersetzen das fehlende Eiweiß.
They replace the missing protein, and that is a causal therapy. The effect is seen after 20 to 30 minutes. The swelling goes down. The swelling of the skin goes down, the swelling in the larynx goes down, and the intestinal swelling goes down. It depends on how quickly the missing protein is substituted. It's injected into the veins, and then, after a few minutes, the treatment starts to take effect.
Der Therapieeffekt.
There is another therapy which has been used most often to date. that is, androgen derivatives. As you know, androgens are male hormones. We also know about their side effects from sport. When athletes want to dope themselves, they take androgens, and the dangerous side effects of these androgens, such as hypertension or high blood pressure and calcification of the arteries, are well known. Women in particular suffer from the side effects because they become more masculine and develop a deep voice and a male pattern of hair growth. The breasts shrink, which is very hard for women to bear. I advise doctors who diagnose this disease to suggest to their patients that they contact the patient organization for hereditary angioedema. This patient organization takes care of those affected, puts them in touch with the next medical center, and knows the specialists, and can then also affiliate the patient with an HAE center so that they can be given additional information and provided with an emergency medication and an emergency card, which in the case of an emergency shows exactly the preparation and the dose that must be injected and the phone number of a doctor at the HAE center. And this really helps them.
Arzt des HAE-Zentrums erreicht und dann ist ihm wirklich geholfen. Dann wenden Sie sich am besten an
that they go to one of the HAE centers. There's a large center in Mainz, another at the University Hospital in Frankfurt. They're the two most experienced centers in Germany. Patients come to us from all over Germany because we have specialized in this. We are a large medical team that has gathered experience in dealing with the disease and with the therapy over many years, and we also train the patients accordingly. We have developed a Frankfurt treatment concept that we offer and which is also preferred by the patients. We know that from international experience, because this treatment concept has the fewest side effects.
Weil dieses Therapiekonzept die wenigsten Nebenwirkungen hat.